Welcome to Talent Talk with SSM Health. My name is Becky Feldman, and today I am joined by members of SSM Health at Home. They will be sharing with us what led them to home health, what a typical day is like, what their greatest challenges and rewards are in this line of work. What amazes me most about these nurses is that it's not just a career to them. They are truly fulfilling their calling. You will be amazed too after you hear their stories. Let's start by hearing how these two got started in nursing and what led them to home health. Dawn?
My name is Dawn Jaspering. I'm the Patient Care Supervisor for SSM Health at Home. I have worked for SSM for the past 18 years, 15 as an RN. I started in critical care, telemetry, transitions to med-surg, orthopedic, and then I was looking for the more personal patient care relationship where I transferred into home care.
I'm Rhonda Glasper. I have been a registered nurse for 30 years now, and 25 of those years have been in home health care. I got the experience I needed to work in home care by working in 2 teaching hospitals right out of nursing school, and that gave me the confidence I needed to be on my own, out in the field, servicing patients.
Can you tell us a little bit more about what are the perks of being a home health nurse?
Absolutely. The perks of being a home care nurse is you definitely have a more personal bonding relationship with your patient. You're in their environment, in their home, they're very welcoming. A lot of times in the acute care setting, they're more under stress and anxiety, and in the home, you definitely are able to fulfill more of a personal relationship with the patient with teaching and guiding them in their disease process.
Much more of an informal setting, being in the home with them. They're just so much more relaxed. That's what makes them.
I know they've mentioned before that their patients are so receptive because they're in the comfort of their own home, so they're very welcoming for the nurses as they come in.
Absolutely.
So it's nice, I think, for the patients, and they get to see the environment, so they can kind of point out some areas that may be struggles for some of the patients, and educate on how to overcome those.
Absolutely.
And I always hear the word flexibility from the nurses in home health. Can you speak a little bit more to that?
Flexibility has been the biggest thing for me. That's one of the reasons that I'm still in home care, because of the flexibility. When I first started, I was a single mom, and it was just easy for me to get my daughter on the school bus, be there at home when she gets off the school bus, so that just gave me a peace of mind.
Absolutely. I agree 100%. Very much more flexible.
So let's talk a little bit more about the biggest differences that you guys see in home health versus hospital nursing.
Sure. In hospital nursing, you're very much more task-oriented of, hanging your antibiotics, passing your medicines. In the home, your patients are, you're doing more of your learning, teaching, the disease process, how to manage their medical condition to keep them out of the hospital.
And they're more receptive, it seems like, once they get in the home.
Yes, absolutely.
In the hospital, they're scared, everybody's coming in and out.
Right.
In home, it's just so much more relaxed. So it seems like they're just more, they're listening to you.
And I know I've heard nurses talk about the call light in the hospital and how that you were really tied to that. And when you're in the home, you're having that one-on-one time with the patient, and you don't have that call light to answer to.
It's just about you and the patient.
Yes.
That's you and just that particular patient.
So you're really building that one-on-one relationship with them to see them progress and have a higher quality of life.
Yes,
absolutely.
So I know that I've heard home health nurses say, with hospital stays getting shorter, they don't necessarily get to see the patient progress. So that's one of the benefits of being a home health nurse. You can see the fruits of efforts and education within the entire family.
Oh, absolutely. 10 years ago, you would have been in the hospital for 3 weeks, if not longer, after having open heart surgery. Now patients are coming home after 5 days. They still require that acute care nursing and education that we are able to provide for them in the home.
Can you guys walk us through what is a typical day in the life of a home health nurse?
For me, a typical day actually starts the night before for me. Just looking at my schedule for the next day, seeing where the patients are so that I can start routing myself. Then I get on the phone and I start calling the patient, setting up a time frame, what works for the patient, and go from there. But it starts for me the night before.
Absolutely. You're able to start your day from home, end your day from home, calling your patients, the same, setting up your visits, doing your visits, you're calling doctors, following up with social workers, physical therapists, kind of bringing the whole team together in home care in between each visit.
Checking insurance, making sure they have authorization and that, checking orders before you go out. Just kind of getting yourself ready for the day.
And we have a huddle that the teams participate in the morning before they start with their patient visit. Sometimes they'll have a patient visit before huddle, but that huddle is kind of that touch base with all their teammates and their supervisor and manager, where they can kind of find out something new about a patient, or kind of find out if there's an announcement or something new that's coming on with the team, or there's new team members. So I think that really kind of starts your day, so you know that you have a team behind you as well.
Absolutely.
And then,
Absolutely.
and I think it's so great that throughout the day, you know, on the way to your first patient, you could stop and pick up a coffee.
Yeah. Oh, yeah.
You
Absolutely.
can, you know, have that coffee with you. Stop in the afternoon, pick up a soda at the gas station in your territory, and
That's another part of that good flexibility that I
yeah.
You do. You have kind of that little mental break in between each patient as you're kind of almost a mental debrief from visit to visit. You know, you can reflect on that visit or think about your next visit while you stop at Starbucks, get a coffee here before you see your next patient.
Dawn, can you walk us through what is a typical patient visit like?
Typical patient visit, an opening visit technically lasts anywhere from an hour to 2 hours as you get to know the patient, their history, their medications, as you form that plan of care that you make between you and your patient. And then we follow up with routine visits that last anywhere from 30 to 45 minutes for the following routine visit. Again, reviewing medications, disease process, teaching them signs and symptoms to help them stay out of the hospital and what to do when those signs and symptoms occur.
So as a home health nurse, you really are the eyes in the home.
Absolutely.
And I've heard stories, and you guys might be able to share some of these. You've identified other needs while you were there, groceries, utility issues.
Absolutely, absolutely. It's you definitely learn the community and the community resources that are available to you, where patients may be choosing medications or food. A lot of times they don't have transportation to get medications. We can find them pharmacies that deliver, and a lot of resources in the community to help them.
And we also have a wonderful home health and hospice foundation, and our social workers will help, and they'll go out to homes and they'll do assessments, and then they can work with our foundation members to take care of some of those needs that there may not be community resources available. And it really, again, it's one of those features where we work together as a team to really care for that patient.
absolutely.
And some of those things, they can be the barrier that prevents a patient from getting better if they're feeling an extraordinary amount of stress about something.
That's right.
Let's talk through what are some of the biggest challenges to being a home health RN?
Some of your challenges is just initially learning your territory, the community. You know, once you kind of figure out where you're going in your community, that's definitely a challenge.
That's the biggest challenge, I think, just learning the community, where you're going, routing yourself, knowing that, and then documentation. It's a big challenge because it's different. Documentation in home care is totally different than documentation in the hospital. So.
And I think you do need to have strong assessment skills. You need to have that confidence in yourself.
Yes.
You had, I think Dawn or Rhonda had mentioned that, you know, you've got this team that you can rely on, but you do want to make sure that you're confident and you're sharing that with the patient so that they know, and then you are able to make a full, complete assessment for the patient so you can be the eyes for the physician. like you
Absolutely,
mentioned.
absolutely.
And we do have a very strong onboarding program for our nurses. Stephanie, can you share a little bit more about that onboarding program?
So we have a formal clinical orientation training that we put our RNs through, and they have a clinical educator who is there with them. They also were assigned a preceptor. The clinical educator and the preceptor can work together. Sometimes they'll have an RN come back and work one-on-one with the clinical educator. Sometimes they're working just one-on-one with the preceptor. They always have their supervisor that they can rely on. They are doing one-on-one meetings with them once a week. And really, they're really closely monitoring them for the first 6 months.
They're not alone.
No,
Yes,
definitely
not
not
alone.
alone.
No.
There's always somebody on the team that can help.
Yeah.
And, you know, we have a great group of nurses, and I have to say that, you know, they definitely want to be there for our new staff, and they'll offer cell phone numbers, and they'll say, oh, just call me with this, or call me with this, or, you know, anytime. And so I think that really is helpful that they know they have that support. We have had new nurses go out to homes, and they'll, something will come up, and they will, you know, call their supervisor, and their supervisor will get in their car, and they'll meet them at the home.
Yeah.
You know, they'll do the preceptor will do it, or they'll put a message out to, we have a great scheduling team also, and they'll put a message out, and we'll have another RN in the territory come by and work with that RN if they need some assistance. So, and if an RN needs a little bit more clinical skills, then we can always utilize our hospitals in the community as well to teach some of those more specific skills if necessary.
So I know, in speaking with both of you, you definitely have found your calling. And some of those stories that we have shared, you've really found your place, and you know why you come to work every day and you do what you do. Can you share any of those stories that stick out in your memory?
Sure, absolutely. I had a gentleman who had called 911. He wanted to go on hospice. He had completely given up. He was young. He had gained about 150 pounds of extra fluid from heart failure after coming out of the hospital. We opened him to home care. He lived in a beautiful log cabin home with a lake. He had been so declined he hadn't been able to walk to his lake or go in his upstairs of his home for a couple years. Throughout the 6 weeks that we were there with him, it was so rewarding and engaging to teach him about his diet, his medications. We diuresed about 100 pounds off of him, and throughout those 6 weeks our visits progressed to the porch and then to the backyard, and by the end of the visits we were, you know, walking upstairs to the upper level of his home, and he was so appreciative of the care, and it was so rewarding. When you left that house, you had that Florence Nightingale feel that you learn in nursing school, that you know, that sense of this is what it's supposed to be
all
like.
about.
This is what it's all about. Definitely find your calling.
Me being an orthopedic nurse, my patients are they get elective surgery, so they're already educated on what they're to expect, the do's and don'ts of surgery. So me going out there just kind of reinforcing everything looks fine, you look good, your incision looks good, the bruising and swelling is normal. Just the peace of mind. I love that.
And plus, you're getting them back to where they
That's
were
right.
before,
That's
you know, in a higher quality of life. So.
That's right. So.
Thank you, Dawn, Rhonda, and Stephanie, for sharing stories with us today. You really bring to life the rewards that come with being a home health nurse. If you are a nurse who would like to learn more about a career in home health, we welcome you to reach out to us. You can send us a message on Facebook, or you can visit ssmhealthcareers.com and click Complete a Quick Interest form. We look forward to hearing from you.